Welcome, everybody. I think we will have a couple people still trickling in, but that's all right. Welcome to this session of the 2025 Culture of Data Conference. Thank you so much for choosing to be here. My name is Grace. I'm your moderator for today. Samantha is our tech host. She's going to ensure that all tech is running smoothly. If you're having any issues, please reach out to her. Everyone's muted right now, so during the presentation, please use the chat if you have any questions. At the end, we have 10 minutes for questions, so you could unmute during that Q&A, the 10 minutes at the end. If you're comfortable, please add your pronouns to your name. You click the three dots on the bottom of your picture and hit rename and add in your pronouns. We have one presentation today. It's about 25 minutes, and again, we have 10 minutes for questions at the end. Our presenter's work today embodies our conference theme by using data science tools to uncover how care access gaps and social determinants like geography, income, and transportation may impact maternal and child health outcomes in Adams County. I'll now turn it over to Ava Cox to present Improving Access in Obstetric Care, Analysis of Obstetric Provider Availability in Rural Adams County, Colorado. Ava, take it away.
Thank you, Grace. Like Grace said, my name is Ava Cox. I use she, her pronouns, and I am a population health epidemiologist at the Adams County Health Department. Adams County is in the Denver metro area, northeast of Denver, and I will go ahead and get started. So just to start off, to give you a brief agenda of what we're going to be going over today, I have an introduction, some definitions that are relevant for the presentation, an overview of reproductive healthcare in Adams County, birth outcomes, and then an obstetric provider analysis. First, to get you guys oriented to Adams County, like I said before, we are in the northeast part of Denver. We serve over 500,000 residents, and the majority live in the western half of Adams County, but we serve a very large rural population, east to like Bennett and Strasburg area. And yeah. And then I work at the Adams County Health Department and in the Epidemiology and Data Science Division in the Health Data and GIS program. So some relevant definitions for this presentation. I want to call out that obstetrics care is not exactly the same as like all OBGYN offices, specifically emphasizing that gynecologists exclude pregnant women from care, like gynecologists only. And so I wanted to specify that obstetrics refers specifically to pregnant women, as they would be unable to receive pregnancy-related care at gynecologist offices. Low birth weight specifically excludes multiple births, so twins, triplets, others, as they're usually low birth weight. Birth rates were calculated by dividing the number of live births in a census tract in 2023 by the census tract's population estimate from 2023 multiplied by 1,000. And then maternal morbidity is defined as any health problem or complication that occurs to a woman during or after pregnancy and childbirth. And they can have short-term and long-term consequences for their health and well-being. And these definitions were taken from birth certificates and recorded when the child was born. Women of reproductive age are defined as women aged 18 to 44. And then all birth and maternal morbidity data was obtained from birth certificates, like I said before. So to give an overview of reproductive health in Adams County. This map is of women of reproductive age, or WARA, by census tract in Adams County, and this is specifically 2023 data. And reproductive women make up almost 20% of Adams County residents. And some areas of note are the Commerce City area. So those darker areas right above the Rocky Mountain Arsenal, and then also the North Glen area. And just keep this in mind later when we look at birth rates. So where women of reproductive age are versus where birth rates are higher. Then looking at the number of live births by census tract. So there were 7,000 live births in Adams County during 2023. In prior years, there were just shy of 7,000 as well. So it's been, the number of births has been slowly increasing over the past 3 or 4 years or so. And the highest counts of live births you can see are in the eastern side of Aurora, in Commerce City, just like the high number of women of reproductive age, as well as some in the North Glen area. And I just want to note that in the eastern half of Adams County, there are higher counts of births despite having a lower population. And again, keep this in mind when we see birth rates later in the presentation. So I looked at live births in Adams County by maternal age, and I wanted to see who these births were occurring to. And so the highest count of births were among women aged 30 to 34, which is consistent with reproductive age for women. And then I wanted to look at household income. And so you can see that households with incomes of 75,000 or more had the highest number of births consistently over the past 3 years. But it is important to note that the second highest group is the group that has income of less than 15,000. And that will show up later when we look at payers for births. The 75,000 is pretty consistent with the average household income in Adams County, which is around 91,000. So looking at maternal educational attainment, from 2021 to 2023, we can see that births occurred most often during women who were high school graduates or those with their GED, which makes sense in the context of who births are occurring to by age group, as we saw women aged 30 to 34 had the highest number of births. And yeah. So keeping in mind the women of reproductive age and birth count maps, note that this is birth rates by census tract, so slightly different. Like I said earlier, it's the number of births divided by the population in each census tract times 1,000, so the rate is per 1,000 people. And so although there were higher rates of women of reproductive age and birth counts in Commerce City and North Glen, we see a little bit of a change. And so we see higher birth rates in Aurora, Thornton area, and just south of the Lock Buoy area, with the highest census tract being the census tract with the highest birth rate being in East Aurora. And also we still see a medium to high birth rate among rural census tracts to the right side of Adams County with 12 births per 1,000 people and 15 births per 1,000 people, which are still on the higher end compared to a few areas that had closer to like 4 births per 1,000. So looking at birth outcomes, now that we've seen who births are occurring to and where they're occurring, we're going to look at some birth outcomes. And so looking at low birth weight, Adams County has 8% of Adams County births were low birth weight, which is pretty consistent with the national average of around 8.2. But it is important to note that it is lower than the Colorado state average. And then, although I looked at mothers reporting receiving prenatal care, I recognize that this is not necessarily the best measure for assessing prenatal care, as it's mother reporting receiving prenatal care ever, not necessarily how many visits and when that started. In the future, I plan on doing further analyses looking at the adequacy of prenatal care utilization measure, which looks at when prenatal care began and the number of prenatal care visits. So although 96.4% is very high, it's important to note that that's ever receiving prenatal care. I also looked at Medicaid as payment among births in Adams County, and remember that about 13% of births were occurring to those with household incomes less than 15,000. And so this makes sense with Medicaid being the most common form of payment, with almost 50% of births being covered by Medicaid. And private insurance was the second highest with 46.5%. I also looked at maternal morbidity conditions, as I mentioned earlier. These are the top 5 maternal morbidity conditions that were reported on birth certificates in Adams County. And another thing that's important to note is vaginal birth after C-section was noted as a maternal morbidity according to the birth certificates, although that is not necessarily considered a bad thing among providers now. But it was the most commonly recorded maternal morbidity on the birth certificate. Yes. So among those common conditions, maternal morbidity conditions in the top 5 occurred in 4.8% of all births. And there were additional maternal morbidity conditions that were not in the top 5, accounting to a total of 12.1% of all births from 2021 to 2023. But that is still considered a relatively low percent, especially since about 2% of that is attributed to VBAC or vaginal birth after C-section. I also wanted to look at maternal morbidity conditions by maternal age to see if there was a correlation between age and maternal morbidity. And the highest count of maternal morbidity conditions were seen among women 35 to 39. So on the higher end of the spectrum, but still, given that there are so few occurrences, I would not consider it to be a correlation. I will now look at obstetric provider analysis, which I looked at provider locations and did a drive time analysis using GIS. So there are 24 unique offices in Adams County and a total of 79 obstetric providers in those practices. Like I mentioned earlier, these are specifically obstetrics. So that includes obstetrics only, obstetrics and gynecology, but excludes gynecology. It also included a few offices that were considered to be maternal and child care specific. Outside of Adams County, there are 62 unique providers, or 62 unique offices and 224 providers at these locations. Although they are not in Adams County, they are most likely other offices that Adams County residents might go to. And there are 2 beyond 470, which is the outlying highway around Denver, but they are only to the north of 470. So like the Brighton area, as you can see in the top part of Adams County. And you can see that there's nothing east of the airport. And so areas, the more rural areas in Adams County are lacking in care or access to care. So I also looked at Medicaid access in and around Adams County. And so I found that 83 provider offices of those 62 outside of Adams County and 24 in Adams County accept Medicaid, which is fantastic. Only 3 provider offices do not accept Medicaid. improving access and is pretty consistent given that 50% of births in Adams County were paid by Medicaid. Relative to Medicaid as a payer, I wanted to look and see what percent of census tracts were covered by Medicaid, and seeing where there were higher coverage rates in pockets in Adams County. And so you can see that there's super high coverage in Aurora and in Thornton, Commerce City area, which is the darker census tracts, as you can see, with up to 44.9% of the population being covered by Medicaid. And you can also see that these are the higher coverage areas are able to go to providers that have accept Medicaid as payment. And then looking at private insurance, you can see the opposite of the previous slide, noting that the northwestern corner of Adams County has a high coverage of private insurance with up to 98.2% being covered by private insurance. So looking at the drive time analysis I did, to orient you to the map a little bit, the heat map, so the blue, yellow, and red colors are indicative of 2023 birth counts. So where births are occurring. I also made sure to note, to call out counts of those births. So you can see in Brighton in the top part that there's 688 births in that bucket. And then although in unincorporated Adams County, it is all blue as in low birth count. Just to give context, that's about 40 births that are being in unincorporated Adams County in that area specifically. And then 118 births in Bennett, which is also pretty rural. For the red dotted line, that indicates a 15-minute drive time. So west of that red dotted line means that residents who live west of that are within 15 minutes of an obstetrics provider in Adams County. And anything east, any residents that live east of the red dotted line are not within a 15-minute drive time. 15 minutes, it being like 30 minutes round trip would be ideal. We will see in the next slide what 30 minutes looks like. Although areas, this is the same setup as the previous map with 2023 births being the heat map, and then the red dotted line indicates 30-minute cutoff. So anything west of the red dotted line are within 30 minutes drive time. Although Bennett is in that, the 30 minutes would be to those providers in Aurora where you see a lot of births. So there could be competition when it comes to access to providers. It's also an hour round trip. I will note that all residents in Adams County are within 60 minutes of a provider, but that means a 2-hour round trip, and it doesn't account for traffic. So the analysis is done based off of speed limits and the roads in and around Adams County, and so it's in an ideal circumstance, not necessarily traffic or 5 p.m. or in the morning. You understand? Yeah. And now we have time for questions.
Don't see, excuse me, I don't see any in the chat, but feel free to unmute yourselves, folks.
Hi, Eva. How are you? Thanks very much for your presentation. I had a general question. Unfortunately, we're probably going back to your slide. I can't recall. There was one you had for covering, I want to say there were maybe no adverse events during the obstetrics visits, or there's something close to that early on, where it's something like 89, 90% something that had no problems coming up, if that sounds familiar. I'm wondering if we took, and I'm sorry if I get into the weeds here, but for everybody else, I'm also an epi, so I apologize. So if we took them out of the denominator and just looked at those who did have some concerns or issues that were raised, do you know if is it likely that we would see any patterns in the types of things that are coming up? Because I'm thinking those numbers are now going to be pretty small. They're like a tenth of a percent or less. But if we cleared out the N and just said, okay, if you had an issue, what are those issues? Could we, I don't know if that had been done, for one, and two, if we did, what those patterns would look like. So somebody doing an intervention might say, we're seeing this issue come up most frequently. We need to direct our resources towards addressing that. So just your thoughts on the process and even what that might look like if it were done.
Are you referring to the maternal morbidity conditions?
Trying to recall, unfortunately my
I'll share a
pulled to the
slide that I
side.
think you're
No
referring to.
worries. Thank you.
Let's see. Is it this one? If it'll load.
This is
Or
the one. It is the morbidity
right,
conditions, correct. So we're
gotcha.
looking at maybe like the highest one being vaginal birth post C-section. Like that's obviously the clear front runner in terms of commonality. But if we took out the 87.9, those numbers are going to shift. So that, out of those five potential morbidity conditions, could we see a pattern that says we need to direct resources early on or increase visibility during ultrasounds, or where we can see certain issues come up, or maybe there's something that's happening between one group and another as far as like lacerations, whether you're getting an episiotomy or anything of the nature. So that area. So I'm wondering if we could see impacts to those potentially.
Yes, when I was doing this analysis, I really wanted to look at race as a factor because I know that women of color tend to experience higher rates of maternal morbidity conditions, just based off of literature that I've read. Unfortunately, I did not have access to race at the time based off of our data set, but that is an analysis that I want to do in the future, as I think that from the literature I've read of like stress being a major factor and just living conditions and different things like that playing a role in these conditions. I definitely am not an expert by any means, but yeah, I would be very interested to read into a little bit more literature, especially about the non like VBAC, as that's now considered a good thing. So
That makes perfect sense. No wonder, no worries there. It's like it
yeah,
is the stratification that makes it a little tougher. So I think I would be more worried about maybe income or in the type of insurance or even insurance status being another one of those potential variables that you look at and say, okay, that's potentially an unfair treatment. Now we're looking at an inequity, not just a disparity. So that's where my brain was going. So,
yeah,
but it sounds like you're already thinking these things as well, whether we have access to the data or not. So that is right.
yes. We there in future analyses, we're planning on doing looking at insurance claims. So I'd be very interested to see what that looks like stratified by maternal morbidity conditions.
Excellent. Cool. Thank you for your time. And thank you for the presentation as well.
Of course.
All right, I see a question in the chat here. It says, is it possible to do the drive time analysis with public transportation?
Yes, it is. In GIS, there's options for walk time analysis for something that would be another project that I'm currently doing is related to tobacco retailers. And we're talking about looking at walk time analysis since there's so many of those and in closer relation to people's houses. But public transportation, that's definitely going to be future directions for this analysis.
A question. I'm wondering if you can speak to how you work with either your the program folks like within public health or community partners to make sure that the data that you're analyzing is utilized to inform like interventions or recommendations.
Yeah, of course. This analysis was originally requested as our maternal and child health team was wanting to find where there were gaps in access to care and where they could potentially do like a mobile clinic or other ways that they could improve access in Adams County. And so that's what this analysis started out as. And we're going even further and doing more analysis with insurance claims. Most of our data comes from the American Community Survey or vital records, so coming from the state based off of birth and death certificates. Well, for this birth. And so those are vetted data sources that we've consistently used. Remind me again, you said in relation to community partners.
Sorry. Yeah, I was just kind of curious how you're working with folks, whether either internally to your organization or external community partners to put the data into action, so to speak, and what recommendations you would make based on it.
Yeah, what I said originally about working with the maternal and child health team. I don't believe anything's been put into action yet, but I'm very interested to see what they end up doing with the data that I pulled.
Thanks.
I have a question. It's a little, like Dennis said, into the weeds, but I'm very curious. On it was slide 25 and 26 where you're talking about where how many live births happened or the births happened. There was like 40 in unincorporated Adams County and 118 in Bennett, and there were no OB providers there. Do those data points mean the birth happened in that place with no OB provider, or do those mean that's just where the parents live?
That's a great question. It is birth data based off of the birth certificate, which has point data for that person's address. So although the birth did not occur there, it occurred to someone who lived in Bennett. So they had the child elsewhere, but it's based off of the mother's address.
Awesome, thank you. All right, I have another question as well.
Go for it.
Could you speak a little to how the care deserts and lack of OB care in certain areas interplays with social determinants of health, how one affects the other?
Yes. So particularly the transportation component of a social determinants of health was the main thing that I was interested in, especially since Someone asked earlier about like public transportation, because that is an important factor, because there could be people living in Bennett and even further that don't have access to a car, and so they have to take public transportation to get to an OB provider. So that's definitely a consideration, especially income that I've included in the presentation, looking at like how like not being able to take off from work to be able to go to an OB appointment, or not having the money to pay for or like not having insurance, or having Medicaid as the payer for the birth and everything leading up to that. Yeah, I'm not sure if that actually answers that, but
Yeah, thank you so much. All right, I don't see any other questions in the chat. So we are going to wrap up a little early today. Thank you so much, Ava. And thank you everybody attending for being here and for engaging in the Q&A portion of the day. Any slides or handouts that Ava has for us will be available in Sketch, so please check that out if you're interested. There is an evaluation after the conference. It's going to be sent to you. It is super, super helpful for the planning committee, so please fill it out, even if you attended one session. We want to know what you think. Adjustments were made this year based on information we got from last year. So it is used. It is really valuable. We will rejoin tomorrow at 9 a.m. We're going to start with her lightning talks. That's new this year. It's 6 5 to 7 minute presentations, 6 presentations that are 5 to 7 minutes long. It's about the future direction of public health, innovations in health justice. So please check that out. It should be very cool. And then tell us what you think about it in the evaluation after the conference. After the lightning talks, we'll have breakout sessions through 2:15 p.m. Look at Sketch for all your options. Thank you again, Ava, for all of your time and work today. It was great to hear from you, and see everybody tomorrow.
thank you.